Now we're going to have Stephanie lay down on her back. This is the hardest position to put your PEC or your patho-PECs in. So we're going to put this up on the wall. She's going to put her feet here. She's going to scoot a little bit closer here. We're going to put a ball here, and I'm going to place her into passive IR because I'm going to help get more adduction of her femur to help get her outlet to be able to expand. In this position, these individuals really need a balloon because it's going to help to get their ribs to come down. And their ribs, because these are individuals that their backs are tight here, we need to turn off the back. And by facilitating and using a balloon, it's going to help get their anterior ribs to get their abdominal muscles, to get their ribs to go down into more internal rotation, and to be able to pull their pelvis back. And the balloon, I think, will make more sense, again, as we go through the respiratory piece tomorrow or later this afternoon. Have you ever blown up a balloon before?
A couple times.
For whatever reason, you guys, the lighter colored balloons are easier to blow up. So give your patients yellow or white. I don't know if this is the coloring of the latex in the balloons. The darker ones are harder. I go through and I teach my patients how to do this step by step. So what she's going to learn how to do is she's going to take a breath of air in through her nose. As she exhales, she's going to pull her ribs down, dig her heels down, and do a posterior pelvic tilt. She can hold this position, then and blow up a balloon for 4 to 5 breaths, or the handout's also going to make it more active. She's going to exhale, blow up the balloon, inhale, bring her pelvis down. Exhale, dig her heels down and come up, and inhale and go back down. But we're going to have her do that with the balloon. Your patients have got to make sure that they keep their low back flat on the table and that they should not feel their back help them in this position. Your patho-PECs love their rectus abdominis muscle. And they're going to try to do this by tightening up that ab versus digging their heels down and using their hamstrings. So you want to make sure that they do not use their rectus abdominis and push forward. So after I teach them how to do that, I teach them how to blow up a balloon, which I'm going to do with her, and then we're going to put it all together. So Stephanie is going to take, I want you to take a breath of air in, and then I want you to blow that balloon up as big as you can for me. Okay. Here's the kicker, though.
Okay.
You cannot let the air of the balloon come out. Okay. But I don't want you to pinch it off with your fingers. Instead, I want you to put that on the roof of your mouth with your tongue and pinch it off like this.
This on the roof of my mouth?
Yep. So I'm going to show this to you. So I want you to do it like this. You're going to pause for 3 seconds after you exhale. Okay. Which you guys will understand later. You're going to take another breath of air in and you'll blow the balloon up bigger. I'm going to demonstrate it for you. I think it'll make more sense. Okay? So I'm going to take a breath of air in through my nose. Get the idea of it? You guys will understand the respiration piece as we go through that, but there's a method behind the madness with every step. So allowing your patients to pinch the balloon off with your fingers is not a PRI breathing technique. If you're doing this exercise correctly, you're going to have your patients pinch that balloon off with the tongue on the roof of her mouth. Because if I ask Stephanie, I know that her resting position for her tongue is down by her bottom teeth. The normal resting position for your tongue is up on the roof of your mouth behind your front teeth. Because she likes to do this. I like to have a reverse cervical spine. I want to put a tongue on the roof of my mouth to get more of a lordosis in my cervical spine. There's a method behind the madness with every step. So for your first breath, we're going to have her take a breath of air in. She's going to exhale through her mouth, dig her heels down, and do her pelvic tilt. And it has to be done on the exhale. So she's going to take a breath of air in through her nose. She's going to exhale, dig her heels down, roll her pelvis back. She's going to keep her low back flat on the table. She's going to keep her tailbone up, and she's going to hold this position. Can you feel your hamstrings? It's going to be hard for her. I want you to take a breath of air in through your nose, and I want you to blow that balloon up. Dig your heels down. Nice. Hold, hold, hold. Breathe in through your nose. And blow, 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 blow. You guys see how hard that is for her to blow up a balloon? It's hard for her to pull her ribs into more internal rotation. Breathe in. Blow. Dig your heels down. See the shakiness occurring? Now she feels her hamstrings. Take one more breath of air in and relax. But that's hard after. That's the hardest thing she did out of the three. Am I correct? Mm-hmm. Any questions with that?